We talk sports medicine with our good friend, Dr. Joe Congini from Sports Medicine Center at Akron Children's Hospital. Good morning, Joe.
Hi, Ray. How are you today?
Excellent, my friend. What do you have for us?
Great. I just wanted to mention, oh my gosh, is this our time of year typically? But our center is just so full throttle right now, so busy. I don't know, partly reflective of our new relationship with the University of Akron and everybody playing sport, but sports medicine, orthopedics, sports rehab, everything just so busy. It's really good to see us back at full throttle and for sure, and super busy and a lot going on. We like it that way. But I wanted to talk about, I get feedback and different people were asking just simply about some of the confusion about different taping that we may use to help athletes be on the field and stay on the field. And I just wanted to touch briefly on three types of tape generally that our physical therapists use. And one of those is called kinesio tape. And that's that colorful, bright green or blue that you may see. And that type of tape, interesting to me as I talk to our physical therapists about how they use it, it can both activate a muscle, but it can also inhibit a muscle. So when the muscles are in spasm or if the muscles are actually causing some of the medical injury and problem, they can shut down the muscle with kinesio tape or activate, get it to fire off in cases where we needed to do that. And it's a very good tape at reducing swelling in a joint. So really good early on in reducing swelling. That's the kinesio or colorful tape. The other tape a lot of people see and ask us about is the dynamic tape, it's called. That's what looks like a tattoo. That is a little bit more stiff, a little bit more supportive, but it actually moves in all four directions, which is unique about it. And so it really simulates the movement of a muscle tendon. And so it is actually kind of filling in for the muscle tendon when the muscle isn't ready to work yet. And so it does help us get athletes back to play sooner with dynamic tape. And typically you'll still see us use a lot of the white athletic tape that we all grew up with. And that is a real stabilizing tape, really kind of stiff. And in the field, that's what we have the most experience with. So on the field, when we have somebody who has a bad contusion or bruise, but even more so an instability of a joint, an ankle, a shoulder, it's one of the tapes that we'll go to. And then we move over to the sideline evaluation after we reduce the pain, maybe ice the joint, maybe get them taped up. And then we evaluate them to see if they're ready to return. I know people watching the game on Sunday with Jadeveon Clowney trying to come back from an ankle injury. That's the kind of thing that we will be doing at games and on Friday nights, and our athletic trainers throughout the region are very, very good at that. And so that they will tape a joint, test. We have to kind of simulate the demands of what the athlete's going to have to do on the field before we make decisions about them returning to play. Athletic trainers do it every day. We do it when we get the chance to be out there on the field, particularly with Friday nights at this time of year with football. But I wanted to also mention, Ray, so as things are full throttle at Sports Medicine, we have just opened a new facility at Pinnacle. I may have mentioned that a few weeks ago, but we have a state-of-the-art physical therapy and rehab and athletic training facility right in Pinnacle Sports on 18, and it's beautiful. If you're out there, get a chance to go out and check it out. If your kids are playing there, coming up here in November, December, a lot of kids move indoor to Pinnacle. And so at Pinnacle Sports, we have a beautiful sports medicine center. We're going to have an open house coming up, and we'll mention it again. But I wanted to mention one final thing. You've been with me so long with this. I didn't know exactly what to make of this 6 months ago, but I got a opportunity and was asked about possibly giving a keynote address down at Nationwide Children's Hospital. And you know that I like to go out and give talks, as we've talked about last week. But this was unique at Nationwide Children's Hospital. I didn't know exactly what to make of what they asked me for the topic. They wanted me to talk about And there is a virtual component to this. So our people that kind of have listened to this before, I'll give the date if people want to hear this talk. But I'm going to be giving a keynote address down there on 35 years of pediatric sports medicine. Where have we been and where are we going? So I think that tells me, Ray, is that I'm pretty old, and it's time now asking for advice and experience. And I really didn't. At first, I wasn't sure what to make of it, and now I really don't mind. I'm really so energized to see all the growth in our field of pediatric sports medicine and all the future growth to come as we look at new ways to prevent injuries, early management of injuries, research, teaching, all the things we get to do in pediatric sports medicine that we're so blessed to get to do. I'm going to get a chance to talk about in a couple months down at Columbus. So it's kind of like what we do every Wednesday morning here, but we're going to get to do it all in one place and talk about where we've been with sports medicine, and it's really kind of fun. So that's kind of an update on on taping. People ask about that quite a bit, and still very helpful to us in getting our athletes back to play.
Perfect selection, by the way, for you, Joe. You've seen it so much change in the world of sports medicine, from not only the nutrition side, the physical side, and then, of course, the preventative measures in regards to heart and concussions and such. That's going to be a terrific presentation because you have seen a lot in the last 30-plus years for sure.
Yeah, we go back to the day of you and I playing, and I think things have changed quite a bit in a lot of different ways. So it really is, medicine moves very quickly, and 35 years is a pretty long time. There have been significant changes. You're absolutely right, Ray, and thanks for giving me the forum and the opportunity to share some of that we're so excited about in sports medicine with your audience. Thanks so much, Ray.
Well, our pleasure, and you're one of certainly the gems of the greater Akron community. Joe, as always, my friend, thanks for the time this morning, and we'll reconnect again next week. Enjoy your week.
Talk to you next week. Thanks, Ray.
All right. There you go. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us.